Good morning, everybody. Welcome to Time for the Holidays with Mimi. Um, Today we're talking about EDS. So May is EDS Awareness Month. EDS is Ehlers-Danlos syndrome. It's a connective tissue disorder. Um, Actually, EDS is like a group of disorders that affect connective tissues. Connective tissues are the tissues that support skin, bones, blood vessels, and other organs. Defects in connective tissues cause the signs and symptoms of EDS, which vary from like loose joints to very life-threatening conditions with your blood vessels. Um, there's different types of EDS. There's hypermobility syndromes. If you have the hypermobility type of EDS, you'll have flexible joints. Um, for example, see how my thumb can, I don't know if you can see this, can go back and touch my arm. Can you see that? That is a type of, like, it's a loose joint from EDS. I'm not 100% sure I have EDS. I've been diagnosed with Lyme disease and fibromyalgia, and I have gone to an EDS specialist, but unfortunately he left the state and went to practice elsewhere, so I haven't been able to follow up. But all my doctors have it down on my records, and see how my joints are weird? Like, see, my finger does not straighten. It's called swan finger. It's just, I have that on each hand where my fingers like bend, all my joints bend funny. So like that's a symptom of it. Some people have really flexible skin, like, they can like pull their skin out really far. In the old days, the EDS people, they'd be in the circus acts and everything, and they'd be able to like pull their skin like really super far. Well, yeah, that's a sign of Ehlers-Danlos syndrome. So anyway, flexible joints, swan finger, cardiac issues, bruising really easy. Like I'll bump my leg and I'll get this grapefruit size bruise from like just a little thing I barely noticed. Fragile skin and scarring, inability to get numb from Novocaine. Okay, now the abnormal scarring, here is an example right here. This is just one that I have. You develop keloid scars. So I hate this so much, but there's like nothing I can do about it. And the more I try to like use scar reducing things, the worse it actually gets. I just hate it. And for some reason, without the normal connective tissues or whatever, our skin like just can't heal normally, and we produce these keloids. If you're having like issues, feel free to tell us below what your issues are down in the comments. We'd all like to hear, from other people like ourselves. And like I said, the inability to get numb. So I had been diagnosed with Lyme disease for a really long time, and fibromyalgia from doctors who don't believe in Lyme disease. I'm not trying to make this video about that, but what led to a possible EDS diagnosis for me was, besides like all the weird joint issues I have, subluxing my ribs constantly, and the weird scarring issues, one of the strange issues I've had over the years is I have a really hard time getting and staying numb from Novocaine. So I totally cannot tolerate like epinephrine. It just makes me feel like I'm going to pass out. My whole body starts shaking. So they started using carbocaine, but it literally lasts like 1 minute and then I can feel pain again. It's like just brutal. And that started for me when I was 17 years old, and I had a surgery when I was awake. And I kept telling them I could feel it, and I think that they all thought I was just nuts or just feeling pressure, not pain. Nobody would believe me. I ended up passing out from it. But yeah, for some reason, people with EDS cannot get numb from Novocaine. I'm just a patient, not a medical professional. So if you are and you understand the reasons why we can't get numb, I'd be really interested in hearing it below. Please tell us below in the comments so we all understand why that is. If you have the other type of EDS, the vascular type, your symptoms might be a little bit different. So I guess the vascular subtype of EDS, sometimes people share the same facial features. I'm not sure why that is. I'd be interested in hearing more if you know more about that. The features of people with vascular EDS include a thin nose, a thin upper lip, small earlobes, and prominent eyes. Also, they may have really thin translucent skin, which bruises easily. Sometimes the underlying blood vessels are visible through the skin too. So there's many different types of EDS. I'm just briefly touching on a couple different times. There's really no cure. Well, there's absolutely no cure for EDS, and the treatments are very limited. Like for me, I wear braces on things. I'm literally careful of every movement I make because everybody subluxes different joints. Like some people might do their shoulder or their knees or whatever. For me, it's my ribs. If I cough, sneeze, lift a grandchild, pick up my dog, roll over at night, anything can make me sublux ribs. My chiropractor is my favorite healthcare provider. I am there quite a bit because he can put them back in pretty fast, and it's like almost instant relief of that pain. And before I knew what was happening, I cannot tell you how many months I would go with just severe pain upon breathing. Every time I'd breathe in or move or twist, I'd get these sharp pains, and I didn't know what it was until I went to so many different chiropractors, and I finally found a really awesome one. Shout out to Dr. Benson in Platteville at the Spinal Institute. He totally does not know I'm doing this, but I love him, and his staff is really nice, and he helps me every time. I had gone through so many physical therapists and doctors, and just nobody could really help until I saw him. But whatever the case is for you, I hope that you can find somebody that can help you, because the pain associated with subluxing something is like really excruciating. Anyway, EDS is believed to be an inherited condition due to gene mutations. Here's a list of the gene mutations. So all these genes provide instructions on how to assemble collagen, which provides instructions for making proteins that work with collagen. So for some reason there's something astray with these genes, and it causes, EDS. Now, if you go to our page, we list a bunch of really good websites on Ehlers-Danlos syndrome, and support groups and forums where you can go talk to other people online, and just more information, patient blogs and stuff like that. So check out our page on it so you can learn more. We also have a lot of EDS awareness items in our shop, so check that out too if you want like a t-shirt or a bumper sticker or whatever to help spread awareness on EDS. Anyway, that's about it. I know this was quick, and I'm trying to make these videos short so people will watch them, but if you want to tell your story about EDS, we really want to hear it, so feel free to leave it in the comments, either on the blog page or on the YouTube video, or in the Facebook group we have. We really want to hear from you and know how you're doing and how EDS affects you. Thank you. You guys all have a wonderful, pain-free day. Bye.